Hello, I am Dr. Anita, working in University College of Medical Sciences and GTP Hospital. In this session, we will be learning about basics of counseling in mother, infant and young child and adolescent nutrition. So what do you mean by counseling? Some say it is giving information to some person, some say it is motivating, or some say it is to listen to the client, and so on. So let's now understand what is counseling. Counseling is a way of working with people in which we try to understand what they feel and help them to decide what to do. Certain skills are used during this counseling. These counseling skills are useful when we communicate not only to the patients or clients, but also with family, friends, or even our colleagues. Communication is an integral and important part of MI/CN program and plays a critical role in achieving the program outcomes. Nutrition counseling is a two-way interaction through which a trainer counselor or trained counselor interacts with mothers and family members to identify individual nutrition needs and goals for mothers and children and discuss way to meet these goals. Effective counseling increases understanding and self-efficacy. Pregnant or lactating mothers are usually very shy. They do not open up easily, especially with someone whom they don't know. So counseling process helps them initiation of conversation with these target groups, that is pregnant and lactating women or adolescent girls, and make them feel that we are genuinely interested to know about them. This encourages them to tell us more, so to understand their concerns and issues in a better way. Thus, basics of counseling in MI/CN plus A essentially involves listening carefully, providing correct information, building mother's confidence, and helping them in decision making. In this session, we will discuss the skills required to conduct effective nutrition counseling and the steps involved in providing good counseling to the target audience. Counselor must use communication skills to provide good counseling. These counseling skills can be strengthened only by practice. So we have to practice, practice and practice. There are three important steps involved in the process of counseling, that is assess, analyze and act. So 3 A's you can remember. Let us now discuss these 3 steps one by one with demonstration. The first step is to assess, which involves establishing rapport with the patient, opening the discussion and gathering information to know more about the problems. To establish rapport with the patient, counselor must greet the patient, ask for his name, he must introduce himself and inform his role as counselor and how the interview will be conducted. It is of critical importance that counselor shows respect and interest to the patient's concern. Counselor must obtain the patient's consent for noting down, or you are taking notes. Let's now see this demonstration A about rapport building. हेलो, नमस्कार।
जी नमस्कार।
बैठिए। मैं डॉक्टर अनीता हूँ। क्या मैं आपका नाम जान सकती हूँ?
जी, मेरा नाम जयंत है।
कहिए कैसे आना हुआ आपका?
जी, मुझे कुछ समस्या है जिसके लिए मैं आपसे डिस्कशन करना चाहता हूँ।
बताइए, मैं आपकी कैसे मदद कर सकती हूँ?
जी मैम।
In this demo, the counselor greeted the patient well and also asked for the name and the consent. Once the rapport is established, the counselor should then proceed to open the discussion with the patient. The counselor must allow the mother to talk while listening to her full set of concern. She should not be interrupted. The counselor must also try to maintain a personal connection with the patient. Let us now see 2 demonstrations to understand what we mean by open the discussion. जयंत
जी जी
दिखाए। अच्छा, हाँ, आप तो डायबिटिक है ना?
जी मैम, वो
कैसा खाना पीना कैसा चल रहा है
जी,
आपका?
आजकल वो थोड़ा सा शादियों का सीजन है,
हाँ,
तो
ठीक
थोड़ा सा
चल
ये
रहा
हो
है,
जाता
ये
है।
जो है ना,
जी जी,
जो
मैं
दवाई आपकी जितनी चल रही है यही चलेगी। और
जी।
इसके बाद फिर आप यही ले, मैंने दोबारा लिख दिया है, इसको कंटिन्यू करना है।
जी, और कुछ
और ये
कर-
फिर आप अगले महीने मुझे फिर दिखा सकते
अच्छा,
हैं, ठीक है? So this was an interrupted discussion as the counselor did not allow the patient to complete her concern. Now let's see how it can be done differently. नमस्कार जयंत जी, बैठिए।
जी जी मैम।
आपकी डायबिटीज़ है ना आपको?
जी मैम,
तो
डायबिटीज़ है।
आजकल खाना पीना कैसा चल रहा है आपका?
जी मैम, आजकल शादियों का सीज़न है, थोड़ा बहुत खाना पीना इधर उधर हो ही जाता है।
मीठा भी खाया जा
जी,
रहा है?
जी, पूरा थोड़ा सा
अच्छा।
परहेज करने में परेशानी हो
तो
रही
कोई दिक्कत आ रही है, कमज़ोरी वगैरह कुछ ऐसा महसूस हो रहा है आपको?
है। जी, थोड़ा बहुत तो लगता है कि आजकल कुछ।
तो कब
सही
टेस्ट कराया था आपने?
मैम 15 दिन से ज़्यादा हो गए।
ओके, रोज़ नहीं कर रहे हैं?
नहीं मैम।
तो करवा लेते हैं एक बार टेस्ट, फिर देखते हैं कि दवाइयाँ कुछ बढ़ाने की ज़रूरत है या उसी पे चलेंगे।
जी मैम।
ठीक है?
जी जी डॉक्टर साहब।
In this role play, the patient was allowed to talk and was not interrupted, so she could share her full concern. This helps the counselor to know more about the mother's problem, and it will enable the counselor to help the mother or the client in a better way. During this discussion, counselor must gather information from the client by using all the 6 listening and learning skills to identify the reason for consultation and also understand her problem. We will be explaining these 6 skills further in the session with the help of role plays and demonstration. After we have listened and understood the patient's problem, we move to the next step in the process of counseling, and that is analyze. After assessing the health and the nutrition of the adolescent, pregnant, and lactating women, and also about the age appropriate feeding practices of a child, the counselor analyzes and identifies what are the nutrition problems and difficulties. If there are no apparent problems or difficulties, counselor praises the client. If problems are detected, the counselor prioritizes the difficulties, and he or she also answers the mother's questions if any. ACT is the third step in the process of counseling. After the counselor analyzes and identifies the problem, they then suggest solution to the client by using 6 skills of building confidence and giving support. We will discuss these 6 skills with demonstration in a while. Let us now understand in detail about the counseling skills that are required for effective counseling of a pregnant woman and a lactating mother for MI/CN practices. The first is listening and learning skills, and the second is building confidence, giving support, and checking understanding skills. We have learned that to gather information from a patient, counselor uses 6 skills of listening and learning. I will now explain you each of these skills one by one with the help of demonstrations. So, the first skill is to use helpful non-verbal communication. Can you tell me what do you mean by non-verbal communication? Yes, non-verbal communication means showing your attitude through your posture, your expression, and everything else except speaking. I will now demonstrate 6 different types of non-verbal communication skills, which are very important for gathering the information from the client. I will be explaining all these 6 skills by 6 pair of demonstration. With each pair, I will be addressing the client in 2 ways. One way helps communication and the other way hinders communication. So please observe carefully as you have to identify the form of non-verbal communication skill I have demonstrated out of these 4. With each demonstration, I will say exactly the same words and try to say in the same way. That is, good morning Radha, how is breastfeeding going for you and the baby? So let's start with the demonstration now. हेलो राधा, गुड़िया कैसी है? हेलो राधा, गुड़िया कैसी है?
जी मैम अच्छी है।
Did you observe which non-verbal communication skill I have used? Yes, this demonstration was showing the non-verbal communication skill of keeping your head level at the same level as of the client. Please also tell which scenario do you think helps and which acts as hindrance. In this we saw two acts. In the first you noticed that the counselor head was higher than the patient, that is he was standing while talking, but in demo 2 the counselor sat with the same level as of the patient. Sitting at the same level helps the communication as it reflects that you are interested in listening to her and wants to know more about what is happening to her. It also shows that you are at her level only, but when you stand with your head level as you did in the first demonstration and you are higher than the client, it hinders the communication. The patient feels that you are superior to her, so can't sit with her. She also feels uncomfortable and finds this intimidating. Now observe the second non-verbal skill which I will be demonstrating to you now. हेलो राधा, गुड़िया कैसी है? हेलो राधा, गुड़िया कैसी है? हेलो राधा, गुड़िया कैसी है? Did you observe which non-verbal communication skill was used in this demo? Yes, this demonstration was showing the non-verbal communication skill of maintaining appropriate distance. So which scenario helps and which hinders? Again, sitting very close or at a distance far away from the mother as shown in first and second role play hinders the communication, and if the counselor is of opposite gender and tries to sit very close to the mother as we saw in the second role play, it makes mother more uncomfortable and hesitant to talk. She will really get flabbergasted. In the third role play, distance between the counselor and the mother was appropriate as acceptable socially, which facilitates the communication. Let's see the third non-verbal communication skill demonstration. हेलो राधा, गुड़िया कैसी है?
जी सब अच्छा हुआ है।
हेलो राधा, गुड़िया कैसी है? So which non-verbal communication skill I have used here? This demonstration was showing the non-verbal communication skill of paying attention, that is eye-to-eye contact. Paying attention and maintaining eye-to-eye contact with the patient helps in communication process. When you look away or see somewhere else, it acts as hindrance. The other person here feels that you are distracted or you are not interested in conversing with her or him. So, eye contact makes the patient comfortable enough to share her problems with you. Let's now look at another pair of demonstration. हाँ राधा, गुड़िया कैसी है?
जी गुड़िया ठीक है, अभी 2 महीने की हो गई है और आजकल इसको थोड़ा सा बुखार रहता है। इसको मैंने कई बार कोशिश की।
हाँ नहीं, वही दवाई देते रहिएगा, सही है, वही चलेगी। हेलो राधा, गुड़िया कैसी है?
जी बहुत अच्छी है, 2 महीने की हो गई है। कभी कभी थोड़ा बुखार आता है तो मैं इसको ठंडे पानी से, सादे पानी से पोंछ देती हूँ।
Can you appreciate which skill the counselor used here? Yes. It is a non-verbal communication skill to remove barriers. We observed two scenarios, one in which the counselor is busy writing notes or talking on mobiles, and in the second, she or he is completely focused on the patient. We all like when the person we are interacting with is interested in listening to us. It is important to remove all kinds of barriers between you and the patient. If there is no barrier, she will feel that you want to hear her seriously, so she would like to share more. Writing notes or talking on mobile phones hinders the communication, as it makes the patient feel that her problems, thoughts, or issues are not important to you. Now I will demonstrate a very important non-verbal skill for gathering the information. और राधा, गुड़िया कैसी है?
जी ठीक है।
हेलो राधा, गुड़िया कैसी है?
जी मैम ठीक है।
So, what do you think about this demo? This demonstration showed the non-verbal communication skill of take time. In the first act, we noticed that the counselor is in hurry, whereas in the second, the mother is given time to respond or to finish her breastfeeding. Which do you feel helps in communication? Yes, it is important to give time to the patient. Do not be in hurry, because if you make the women feel that you don't have time by looking at the watch, she will not be able to open up to share her experience or the problems with you. Because if you make the women feel that you don't have enough time by looking at the watch, she will not be open up to share her experiences or problems. Now we have come to the last demonstration of non-verbal communication skill. Look at this carefully.
कैसी हैं राधा जी? कैसी हैं राधा जी? और बेटे का क्या हाल है?
ठीक है. I think everyone here will agree that touching appropriately will make the patient comfortable and so to communicate better. So touching a patient helps in building rapport, but one has to be very careful to do it. It has to be appropriate and in a way socially acceptable. If you are a male counselor, sometimes it may not be possible to touch the women, but you may always touch the baby appropriately and build the rapport with the mother. So let's quickly revise all the 6 helpful non-verbal communication skills we learned just now. They are: keep your head level, keep appropriate distance, pay attention, remove barriers, take time, and touch appropriately.
कैसी हैं राधा जी?
अच्छा, बढ़िया. Do you know any other helpful non-verbal skills? It can be smiling, nodding. Let us now move to second skill under listening and learning skills, and that is ask open questions. We will first understand the difference between the open and the closed questions. Open questions usually starts with how, what, when, where, why. For example, how is breastfeeding going for your baby? What are you giving him to eat and drink? These are open questions and they cannot be answered in yes or no. Whereas closed questions usually starts with words like are you, did he, or has he, or does he, and the mother answers them in yes or no. For example, are you breastfeeding your child? Is your baby doing well? Now I will be explaining this skill with the help of demonstration. We will look at two demonstrations that will help us understand how by asking open questions we spend less time and can gather more information from the mother. हेलो राधा, गुड़िया ठीक है?
जी
इसको अपना दूध ठीक पिला रहे हैं?
जी ठीक से पिला रही हूँ।
कोई मुश्किल तो नहीं आ रही है?
जी नहीं।
So what did you notice in this conversation? As the counselor was asking close question here, she could not learn much as the patient was replying on only yes or no for an answer. Let us see the second role play of asking open questions to which mother answers in detail. हेलो राधा, गुड़िया कैसी है?
जी मैम अच्छी है, बस आजकल भूख ज़्यादा लगती है इसको।
अच्छा, कैसे आप इसको दूध पिला रहे हैं?
अपने दूध भी पिलाती हूँ और कभी कभी ऊपर का भी देना पड़ता है।
तो आपको कैसे लगा कि बच्चे को ऊपर के दूध की ज़रूरत है?
मैम इसको भूख कुछ ज़्यादा लगती है, बहुत जल्दी जल्दी भूखी हो जाती है, मुझे ऐसा लगता है, इसलिए इसको ऊपर का दूध देना पड़ता है। मुझे लगता है कि मेरे दूध से इसका पूरा नहीं हो रहा है, कम पड़ रहा है मेरा दूध, मुझे लग रहा है इसको ऐसे।
In this conversation, we noticed that the health worker asked open questions. The mother could not answer with a yes or no, but had to answer in detail. The counselor was able to learn more about her feeding practices and difficulties like mother's perception of not having enough milk and baby receiving bottle feeds. Later, this information helps the counselor to suggest the client appropriately. Let us now understand skill 3 of listening and learning skill, that is, reflect back what the mother says. Many times we ask factual questions, but answers to them are often not useful. For example, if mother says Rahul cried a lot last night, we might ask how many times he got up then. She might say 4 or 5 times, but this answer is not useful to us. But if we repeat or reflect back what mother says, the answer we get is usually more useful. In reflecting back, what mother says should be done in a slightly different way so that it doesn't sound that you are copying her. It is important to repeat the things about which you want to know more from the mother so that you can track her to the direction or information you want to know. This also makes her feel that you are interested to listen to her and want to know more about what is important to her about her baby. For example, if mother says Rahul cried a lot last night, we can reflect back as your baby kept you awake the whole night. It shows that you understand her and she is more likely to say more about what is happening to her. Let us look at a demonstration now which will help us to understand this skill. हेलो राधा, गुड़िया कैसी है आजकल?
जी मैम दूध बहुत पीती है, बहुत भूखी रहती है।
अच्छा, बहुत भूखी रहती है?
जी पिछले 1 हफ्ते से मुझे लग रहा है इसको बहुत भूख लगती है, मेरा दूध शायद कुछ कम पड़ रहा है इसको, इसलिए ऊपर का देना।
एक ही हफ्ते से ऐसा हो रहा है?
जी मेरी बहन भी कह रही थी कि एक आपको मुझे कुछ इसको ऊपर से देना पड़ेगा, ऊपर का दूध पिलाना चाहिए, बोतल का, वो उसने बोला कि बोतल का दूध पिलाना चाहिए, इसको दूध कम पड़ता है मेरा बहुत।
आपकी बहन ऐसे कह रही थी?
जी।
So just by reflecting back what the mother says, we got so much information about mother's perception and dilemma of starting bottle feeds. We also got the information that her sister is influencing her for the bottle feeding. The next skill to gather information from the patient is use responses and gestures which show interest. If you want a mother to continue talking, you must show that you are listening and that you are interested in what she is saying by showing responses and gestures. Example is using gestures like look at her, nod, smile, and responses like ah, oh. Let us look at a demonstration to understand more about these skills. Demonstration using responses and gestures which show interest. हेलो राधा, गुड़िया कैसी है?
जी कल इसको कुछ उल्टी हो गई थी और मैं तो डर ही गई थी, कहीं इसको कुछ हो तो नहीं गया, ऐसे उल्टी होना तो खतरनाक लगता है। पहले तो कभी ऐसा नहीं होता था इसके साथ।
During the conversation, we noticed that the health worker asked open question to start the conversation, and then she encouraged the mother to continue talking with responses like oh dear, ah, and gestures like nodding, smiling, and raised eyebrows. Skill 5 of listening and learning skill is to empathize. It means to show that you understand how mother feels. If mother expresses her feeling, it would be helpful to respond in a way which shows that you understand her feeling from her point of view. To explain this, let me share an example with you. A mother complains, "My baby wants to feed very often and it makes me feel so tired." The counselor replies, "I can understand. You are feeling tired all the time then." This shows empathy. It is important to understand the difference between the empathy and sympathy. When you sympathize, you are sorry for the person and you look at it from your point of view. Whereas when you empathize, you look at it from her point of view. Let me explain the difference between sympathizing and empathizing with the help of two demonstrations. हेलो राधा, गुड़िया का दूध पीना कैसा चल रहा है?
जी ये तो आजकल बिल्कुल दूध नहीं पीना चाहती है। मेरे को लगता है कि इसको मेरा दूध पसंद ही नहीं है।
ऐसा होता है, मैं भी जब काम पे गई थी उसके बाद मेरे बच्चे ने भी ऐसा करना शुरू कर दिया था।
ओह,
तो ऐसा करते हैं बच्चे। In this conversation, the health worker sympathizes and turns the attention to her own situation. This is not helpful. Let us now look at the second demonstration. हेलो राधा, गुड़िया कैसी है आजकल?
जी मुझे लगता है एक तो इसको भूख बहुत लग रही है और ये मेरा दूध बिल्कुल नहीं पी रही है। मुझे लगता है इसको मेरा दूध अच्छा नहीं लगता है।
मैं समझ रही हूँ आपको अच्छा नहीं लग रहा होगा ऐसा।
ये पिछले 1 ही हफ्ते से हुआ है, जब से मेरी सास घर आई है तब से ही सिर्फ ऐसा हो रहा है।
In this conversation, the health worker empathizes with the mother's feeling and learns some very important things without asking direct questions. Empathy can be used not only for bad feeling but can also be used for good feeling. So now the final skill in listening and learning is to avoid judging words. Most of the time we use judging words like right, wrong, well, badly, good, enough, properly, etc. while talking to the mother. For example, is your baby doing well? Or is your baby feeding normally? She doesn't know what is the correct for her or for her baby. She might not know what is normal feeding pattern for her baby, so might get confused to answer. She might also feel that whatsoever she is practicing can be wrong, or she can also think that my baby is doing something wrong. His feeding pattern is wrong. This makes her lose confidence in herself, thus opening up less with us. So, one should always ask, how is your baby doing? Or, how is baby feeding? Thus avoiding judging words. Now I will explain both situations, one using judging words and another avoiding judging words with the help of a demonstration. हेलो राधा, गुड़िया का दूध पीना ठीक चल रहा है?
जी ठीक चल रहा है जी। ठीक।
ये आपका दूध पूरा पड़ जा रहा है इसको?
मुझे लगता है पूरा पड़ जाता होगा।
अच्छा, और वज़न ठीक बढ़ रहा है ना इसका?
ठीक कह नहीं सकती, ठीक ही होगा। ठीक।
In this conversation, the health worker is not learning anything useful, but she is making the mother more confused and worried. Let us now look at the second scenario. गुड़िया का दूध पीना कैसा चल रहा है?
जी अच्छा चल रहा है, मेरा दूध पी लेती है।
अच्छा, तो कितनी बार आप इसको दूध पिलाते हैं?
मैं दिन में 7-8 बार तो दूध पीती है कम से कम।
वजन इनका कितना बड़ा है मैं देख सकती हूँ? आप कुछ
जी।
कार्ड लाए हैं क्या?
जी जी, मैंने वो कार्ड दिया ना।
अच्छा, यहाँ
इसमें,
रखा है
हाँ,
आपने।
इसमें सिस्टर जी ने नोट करके दिया है। पिछली बारी से तो 1 किलो वजन बढ़ गया इसका।
ओके, आप बड़े खुश नजर आ रही हैं
जी,
इसलिए।
बहुत खुश है, बहुत अच्छा लग रहा है
चलिए,
मुझे।
अच्छी बात है ना, आपका सारा दूध उस बच्चे को मिल रहा है,
जी।
इसीलिए उसका वजन ठीक बढ़ रहा है, अच्छा बढ़ रहा है,
जी।
जितना बढ़ना चाहिए।
जी जी, बहुत अच्छा लग रहा है।
From this conversation, we came to know that the health worker learned what she needed to know without making the mother worried. So, till now, we have covered all the listening and learning skills. Now, Dr. Mukesh will be taking confidence building, support, and checking understanding. Thank you.
Thank you, Dr. Anita. I am Dr. Mukesh Yadav, Senior Specialist Pediatrics, Sanjay Gandhi Memorial Hospital, New Delhi. I will now talk about confidence building, support, and check understanding. This skill is important to make mother feel that she is not doing anything wrong. It is also important to avoid telling a breastfeeding mother what she should do. Building confidence and giving support includes 6 skills, and I'll be explaining them one by one. Skill 1: accept what the mother says. This skill is used to address a mother who has a mistaken idea or believe in something that you do not agree with. If you disagree to what she is doing, you may make the mother feel that she is wrong. This reduces her confidence and she may not want to say anything more or open up to you. If you agree to her mistaken idea and you want to correct it later, she may feel that you are yourself confused or you are not sure. But if you accept her idea in a neutral way, this will help to correct her later without criticizing her. So, accepting is not to agree or disagree, but to accept in a neutral way to the mother's mistaken idea. For example, mother could be saying, my milk is thin and weak, so I have to give bottle feeds. Your response could be, first, oh no, milk is never thin and weak. It just looks that way. This is disagreeing to what mother said. Second, you can say, yes, thin and weak milk can be a problem. This way you are agreeing to her. Third response could be, I see, you are worried about your milk. This is a neutral response. Second skill is recognize and praise. We must first recognize what she is doing right and then should praise those practices. This will build her confidence. Encourage her to continue these practices. Let us see this example. Mrs. Anju, 8 months pregnant, comes for checkup regularly but not taking medicines, specifically iron as advised. Her hemoglobin is less. She is not, and it is not improving. Now she is complaining of weakness also. Do we have anything to praise here? She is not taking medicines regularly. Her hemoglobin is not improving. She is feeling weak also. Yes, we can always say, it is good you are coming here and getting your checkup done regularly. This is praising. After having praised her, now if you tell her that hemoglobin will improve and weakness will go if medicines are taken on time, she will be more receptive. Skill 3 is to give practical help. Sometimes giving help is better than saying anything. For example, help her with sitting comfortably in later stage of pregnancy, offer drink or something to eat after delivery, help her in positioning the baby during breastfeeding. Now, skill 4 is use of simple language. It is important to use simple words and familiar terms that the woman understands. For example, if I want to counsel her on maternal nutrition, I may say, minimum diet diversity is important for your health. This is too technical, and the mother will not understand what is the meaning of minimum diet diversity. Simpler ways to explain this to her that daily intake of foods from these minimum 5 groups is important for your good health. This is use of simple language. Skill 5 is to give relevant information. It is important to give information which is relevant to her situation now. Always tell her things that she can use today and not later on. Try to give 1 or 2 pieces of information at a time. Give information in a positive way. For example, the mother has brought Sonu to immunization clinic for injection at 6 weeks. What information do you think we should give? Our response should be, next vaccination of Sonu is due at 10 weeks and to continue to exclusively breastfeed till 6 months. Skill 6 is make suggestions and not commands. You must be careful not to order or command her to do something. You should rather suggest what she could do than let her decide. For example, we can tell the mother that you must feed Sonu only your milk at 6 months of age. Now, this is a command. It might help Sonu grow well if you feed him only your milk, not even water, till 6 months of age. And would you like to do that? Now, this is a suggestion. Well, now, as we go through the counseling skills, a very important aspect is to know that the mother has understood all and in the correct way as you wanted to deliver your messages. So we have to check the understanding. It is important to assess how much a mother has grasped essentials of nutrition for herself and her child. It must be done in a way that she should not feel that she is undergoing an examination. Otherwise, it may affect her confidence. Checking understanding should be done by making mother comfortable, asking open questions about her knowledge, filling up gaps while the mother is explaining a task, helping in performing tasks, and by praising. With this, we come to the conclusion of this session. One thing to remember is that we should try to use as many of these skills as possible during a counseling session, and use of these skills may not be in a sequence that we have learned. Like we can praise as early as possible at the first opportunity, but we must check for understanding at the end of the session. I hope you have learned the skills of listening, learning, building confidence, and check understanding very well, and will be able to use your skills during your counseling sessions. Thank you.